Hello. The purpose of this video is to prepare you for your mental health evaluation. Now, you'll be working very closely with Telemedica during your evaluation. Who is Telemedica and who are our providers? Telemedica was originally created to offer reasonably priced solutions for veterans to access a high-qualified team of providers through a simple, easy, and convenient telehealth format. We at Telemedica understand the importance of self-care and thrive on assisting veterans with navigating the VA compensation and pension process. Together with our comprehensive network of providers, we have joined forces to bring a HIPAA-compliant evaluation process that matches the needs of the veteran community with the expertise of diversely skilled, independently contracted providers. Our providers are contractors who work directly under the Telemedica umbrella. Many of our providers have expertise working directly with the VA and are skilled in completing psychological evaluations. Our team of providers includes a quality assurance department and clinical advisor to ensure our providers are competent and provide a quality report. Words of wisdom. There is no greater weapon than a prepared mind. So, let's get you prepared for your evaluation. Before your appointment, there are some key things that you need to complete in order to make this process run smoothly. First, it's very important that all of your records are downloaded into your file. Those records can include, but are not limited to, your DD-214, medical records, buddy statements, any court documents, any disciplinary documents, and/or your trauma statement if it is relevant. The second thing we need you to do before your appointment is to test the Doxy link. So the Doxy link is going to be provided for you once you make your appointment. Your appointment will be completed using a telehealth format. Therefore, it's very important to ensure that you're able to navigate the program as well as you have consistent internet so that this process can be complete and be most effective and efficient. The third thing we need for you to do is have a government issue ID available the day of your appointment. This can include a passport, a driver's license, a government issued ID from the DoD, or any other ID that has your picture included on the document. So now, collecting your medical records. You can have a buddy letter from someone that you served with, someone who was in your chain of command while you were in the military, or anyone else who can testify or provide additional information about some of your experiences while you were enlisted. It also may be important to gather information from your spouse, a close family member, or a friend who can provide information about your current status and any social or occupational impairments that you are dealing with at the present time. Also, it's very important to include any current service-connected disabilities, along with the level of percentage that you are service-connected. This information can be obtained through e-benefits. Also, it's most important that you have a copy of your DD-214, and that also can be located on e-benefits. So now we've gotten to the evaluation process. What do you need to know about this process? First, we would like for you to ensure that on the day of your appointment that you are in a secure private location. And this is most important because this process will require you to disclose a lot of confidential information. And we want to make sure that you're in an area where you feel comfortable with talking about such sensitive information. Also, it's very important that if you're not comfortable talking about your trauma in detail during the appointment, 72 hours before your appointment, it's important that you submit your trauma statement. I know that sometimes you're able to remember more information when you're not in such a short, small time period. So if you submit that trauma statement prior to your appointment, you may be able to provide more detailed information with times, dates, places, or any important people or other information that may help with presenting your trauma while you were in the military. Also, make sure that you have a complete, up-to-date list of your medications the day of your appointment. Although you've submitted your medical records in advance, you may have had some changes in your medication, the dose, before your appointment. So it's important that the provider has the most relevant information when it comes to your medication. Up until this point, I know that you've probably received a lot of information about the evaluation process, as well as you have information about the rating scales, as well as the symptoms that are used in order to come up with a diagnosis during the day of your appointment. Those things are very important. However, the job of the provider is to determine the most appropriate diagnosis for you. Prior to your appointment, you've probably filed or suggested that you have a particular diagnosis, and that's very important. However, if you focus only on the diagnosis that you are filing for, it doesn't give the provider an opportunity to see the whole picture. And there may be other relevant diagnoses or information that may be important during this process. So, your appointment is really to tell your individual story. Talk about your current impairments and how your life is right now. This process is to do what we call do a Nexus Statement. The Nexus Statement is to make a connection. And what the provider's goal is to make a connection between situations that you experience in the military and how they have affected you currently. Or if you have a service-connected disability, how it causes you social and or occupational impairments now. So don't focus so much on what the diagnosis is, but focus more on your life, telling your historical picture as well as your current picture. That's what's most important. Your provider is going to ask you a variety of questions that will range from your childhood all the way till present. So it's very important that you talk about your childhood, your time in the military in detail, and how you're functioning now. And that way the provider can then make the most accurate diagnosis. And note that the diagnosis that the provider comes up with at the end of the evaluation may differ from what you initially applied for. But that's okay, because the purpose of the evaluation is to find out what's most appropriate for the diagnosis for you. Now, also, it's worth noting that one diagnosis does not ensure that you'll get a higher percentage versus another diagnosis. For example, you may have a major depressive diagnosis that may have a very high rating, and someone else may have a PTSD diagnosis that has a lower rating. So the actual diagnosis is not what's important when it comes to rating the level or percentage of impairment. So please don't focus so much on making sure that you meet the criteria for a certain diagnosis, but focus on telling how your life is. I can't express that enough. To tell your story, not to limit yourself to making sure that you have a certain number of symptoms that fall in a certain percentage according to the rating scale that you may have. Also, it's very important that you go in detail with every question that a provider asks. I understand that we're asking you to kind of open up and be very transparent to a provider that you just met. And so if you need to take your time and if you need to really express yourself, please make that known during your evaluation. Please note that your appointment is scheduled for 60 minutes. And so that is a brief time frame in order to cover a lot of information. So you are definitely welcome to ask questions to your provider on the day of your appointment. But note that the very limited time that is provided is really needed to tell your story. And so any questions that you may have that are non-clinical related, please address with your clinical coach prior to or after the appointment so that it gives your clinician the opportunity to really capitalize and use the 60 minutes that they have assigned for your appointment. Now, if you need to take a break, if you need to have a second because we are asking you to do such a difficult task, please make that known to your provider during your evaluation, and those things will be factored in to your appointment time. So, the main goals and the things that we definitely want you to do. We want you to upload your records in a timely manner so that it gives the provider the opportunity to review the information and to ask relevant questions based on your history and your current treatment if there is any. Be prepared for your evaluation. And in being prepared for the evaluation, make sure that you are in a secure place. Make sure you're in a place where you feel confident and comfortable to disclose important information. Make sure that your internet is secure and that you are able to navigate the telehealth format from the doxy. Also, be prepared to be open and honest during your evaluation. We are asking you once again to disclose information that is very important and very sensitive, and we understand that. But in order to provide you with a quality product, we definitely need you to be open and honest and not focus so much on diagnosis, but focus on your individualized situation. And the last thing that we want you to do is, after your appointment is over, you will receive a signed copy of your evaluation in your portal. Please review this document thoroughly. If there are any errors as far as dates, names, any information, please note that. As noted earlier, please keep in mind that the diagnosis that you originally claimed may change after your provider completes your evaluation. But however, this does not determine the percentage of service connected or the percentage of impairment documented on your report. So once again, please do not focus on the diagnosis, but really focus on providing the evaluator with an overall picture of what's going on in your current life, what situations you experienced while you were in the military, as well as how your life was prior to entering the military. And that's what's the most important elements of this evaluation process, to really make that connection. Thank you for your time and your attention for this presentation. And once again, if you have any additional questions or concerns, please contact your necessary staff members in order to address your concerns. Thank you and have a wonderful day.